Hello everyone, welcome back to my channel. This is your host, and in this episode, we are going to talk about an introduction to epidemiology. So, let's start with what is an epidemiological study design. Epidemiology is the study of the distribution and determinants of health-related states or events in specified populations and the application of this study to the control of health problems. The purpose of an epidemiological study is to identify factors that cause or contribute to the occurrence of a specific disease or condition, ultimately leading to the prevention and control of the disease or condition. Epidemiology involves the study of the frequency, pattern, and causes of health-related events in populations over time. The term epidemiology was coined by the Greek physician Hippocrates in 1801. But the origins of epidemiological thinking can be traced back even further to ancient India, China, Egypt, and Greece. Some of the earliest recorded instances of epidemiological thinking can be found in the works of Indian and Hindu Kush physicians who describe the association between environmental factors, such as air, water, and soil quality with the spread of diseases such as cholera and malaria. Similarly, ancient Chinese texts contain descriptions of outbreaks of infectious diseases such as plague and smallpox, as well as the factors that may have contributed to their spread, such as overcrowding and poor sanitation. Egyptian and Greek physicians also made early observations about the relationship between environmental factors and disease, such as the link between contaminated water and cholera. However, it wasn't until the 19th century that epidemiology emerged as a distinct field of study. The work of several key figures, including John Snow, a British physician who is considered to be the father of epidemiology, Florence Nightingale, an English social reformer and statistician, and William Farr, an English medical officer, laid the foundation for the field. These pioneers made significant contributions to our understanding of the patterns and causes of disease and helped to establish epidemiology as a vital tool for public health and medicine. Today, epidemiology is an essential component of public health and medical practice. Epidemiologists play a critical role in identifying and controlling the spread of infectious diseases, chronic conditions, and environmental hazards. They work in a variety of settings, including government agencies, universities, and private companies, to conduct research, develop interventions, and monitor the health of populations. Coming back to the definition, there are two components of the definition that I just shared. The first one is the study of the distribution and determinants of health-related states or events. The second one is the application of this study to the control of health problems. So let me explain these two components. The first component, which is the study of the distribution and determinants of health-related states or events. Distribution refers to the frequency and pattern of health-related events in a population. For example, how many people in a population have a particular disease? What is the incidence rate of a specific condition? What is the prevalence rate? And so on. Determinants, on the other hand, refer to the factors that influence the occurrence of health-related events. These can include personal characteristics such as age, sex, and lifestyle, as well as environmental factors such as air and water quality. By studying the distribution and determinants of health-related states or events, epidemiologists can identify risk factors for disease and evaluate the effectiveness of interventions aimed at preventing or controlling disease.